That movie, when we were watching, we were in the tears actually. We saw that how many women wanted to become a mother. Not being a mother is been ostracized in. We were also looking towards that our journey where we are trying to improve the IVF workflow, where IVF can be more meaningful and more easily accessible to many people. You did a medical degree around 1978, and 1978 was the first time the first IVF baby, Joy Brown, was born. So you have seen from your eyes how the IVF became a hype.
Professors and all used to say, it all looks very far-fetched, and I can never imagine that 48 years down the line or 47 years down the line, it has become an everyday procedure for
Yes.
every nook and corner of the world. Around 10 lakhs it used to be those days.
My God.
So 10 lakhs was a big amount, those
You
days.
can have 3 ambassador cars.
Or you could have a big building to make a big
Yeah.
hospital. Everything is done in a lab. When we have eliminated all the other factors which were coming in our way, still we are not able to give them their own child.
Yeah, we are getting married quite late in our life, and so the childbearing we are also doing later in our life.
So nature is also very smart. What it does is actually it doesn't release all the eggs at the same time. So only one cohort is released, which is about 20-30 eggs. Keeps it like a bank inside. Doesn't want it to come to that level where it will be acted by the brain hormones.
Okay.
I think maybe in Indian rural areas also, like this is happening, and the semi-urban areas where they get married early and have one baby. So they're not at least that much worried like our city girls.
So you consider that women in the present time they should try to conceive as early as possible.
Yes, yes. The very good option which is there for everyone is called as a social egg freezing,
Okay.
which so many celebrities did.
Yeah.
I can even mention the names because they openly wrote about it. So then I said yes, I know that we can artificially create a baby. So he said not artificial, it's a real baby they created, and they put it, and then this girl was born like that. So that was the time.
Hello everyone. Today we have great honor to invite Dr. Kiran D, Sekhar, who is one of the first or one of the pioneer in IVF treatment, the one who bring the IVF treatment in India. And she has over 50 years of medical treatment and has treated numerous amount of patients. And she also hold the Vice President position of Federation of Obstetric Gynecological Society of India. Because of holding that position, she has been pioneer in policy making regarding the IVF and fertility treatment in India. She also holds the gold medalist from Osmania Medical College, and she has been a managing director of Kiran Fertility Center. And this fertility center has 8 centers all over India, in Hyderabad, in Telangana, in Andhra Pradesh, in Delhi, and in Bangalore and Chennai. So let's welcome Dr. Kiran D. Sekhar, who has trained more than 100 clinicians to really get to know about how to do IVF, how to do egg freezing, how to do the implantation of the fertilization of the egg, sperm selection, computer-aided semen analysis, many more things. He gave lecture in many places, and she get invited by recognized places like European Society of Human Reproduction and also American Society of Reproductive Medicine. So we have honored to welcome who has formed and transformed the IVF culture and policy and the whole landscape of India. Thank you, Dr. Kiran.
Thank you very much, Dr. Dilip, for having me on this podcast, and I hope the conversation we have today would be of benefit to everyone.
Yeah, definitely. It is a very my honor that you came. Since I was going through your profile, and you have done your medical degree almost 50 years ago. And I saw that you did a medical degree around 1978, and 1978 was the first time the first IVF baby, Joy Brown, was born. So you have seen from your eyes how the IVF was became a hype and the apprehension. So I would like to ask you that uh, India being not that much open to many medical treatment, how the IVF society or IVF perception or IVF treatment has evolved in last 45 years or 40 years.
Yeah, just to start from the point, like you mentioned, Louis Brown was born,
Yeah.
in 1978, and around July, I think July was her
July.
birthday. So and those days, after that, we had our final MD exams.
Yes.
in which again, like I scored a medal. So
Yeah.
the examiners were from Bombay and from, like other places in Bihar. So he asked me, this question. Have you heard about this new technology in IVF? Have you heard, So like I had heard it, like I had
Yeah.
studied it also. I thought they may ask,
Hmm.
So then I said, yes, yes, I know that we can artificially create a baby. So he said, not artificial, it's a real baby they created and they put it, and then, this girl was born like that. So that was the time. And our professors and all used to say, like, it all looks very far-fetched, and I can never imagine that 48 years down the line or 47 years down the line, it has become an everyday procedure for
Yes.
every nook and corner of the world.
Yeah.
So, like, technologies, when we actually develop them, they are for human use, isn't it? So,
Hmm.
like, that day also, I was watching a movie on Netflix,
Yeah. Yeah. I have
where
also seen
you
the
have also
joy.
seen that, yeah.
Yeah.
So, they said how these three scientists were so particular, they were so devoted, they were so, involved in the whole process. And finally, out of 280 embryos, only one embryo implanted, and that was in a natural cycle. And now from there where we have come, now we are talking about your product and your things which you
Yes.
are developing,
Yeah. Yeah.
where we are going to select the best of the sperm and put it inside the egg.
Actually, that movie, when we were watching, our team were watching, we were in the tears. Actually, we saw that how many women wanted to become a mother. Not being a mother is been ostracized in even 50 years in the Western society. Not even in India, even in Western, it was ostracized. So we were almost in tears, and when we were watching, we were also looking towards that our journey where we are trying to improve the IVF whole workflow, where IVF can be more meaningful and more easily accessible to many people. So it was quite touching and tear producing for us. And I also saw that you have predicted well early in 80s that because of pollution, because of lifestyle issue, because of many other factors, the infertility is going to rise. It was not even in the mainstream, no one was talking about. And would you like to shed a light on it? How do you think in the present time which factor is going to be the most concerning?
Yeah, like, I would like to talk about the ovarian reserve and deteriorating, the mitochondrial functions, the DNA functions, and overall quality of the eggs and sperms. So when I started this about 33 years back, I'm telling you, out of my own pool of patients, like I used to do laparoscopies, hysteroscopies, ovulation induction with drugs. So when I could, like gather the whole thing, and, like investment also was high at that time.
Yes.
So just to tell you about the cost and all, we can
Yes.
discuss. Around 10 lakhs it used to be those days.
My God.
So 10 lakhs was a big amount, those
You
days.
can have 3 ambassador cars.
Or you could have a big building to make a big
Yeah.
hospital, So they said, why in such a tiny space you are making an IVF center? Who will come to you? So I said, okay, from my own pool only, I have about 40, 50 patients whom I'm treating for infertility at present. So out of them, I took around 8 patients, who were little bit able to afford the treatment also, So, uh, and out of them, all of them were towards their later reproductive years, not like this, like they were in those days also, they had tried for 18 years, 10 years,
Yes.
15
Yes.
years. So
Yes.
they were in the later years.
Hmm.
And like, out of the 8, I was thinking, even if I get one pregnancy,
It
at
is a
least that
success.
patient will come and sit outside and talk
Yeah.
about us and say others
Yeah.
can come. But you will be surprised to know, out of them, 4 patients conceived.
Oh my God. That's
Four
wonderful.
patients consider. I'm not saying that the treatment was like that, but they were waiting for that kind of treatment. Something was wrong with the sperm, maybe, I didn't go into those details at that time.
Yeah.
Something was wrong with the egg, this thing, like, they were not able to meet. Or, like, and then the point you were asking me is egg quality was very good. Even in those ladies who were reaching, the far end of their reproductive career, still their egg quality was good and still the sperm quality was good. Only 1 or 2 patients I had who were azoospermic in that. So, that then we had a this thing. That time also we used to have the consent forms and all and take their permission and do. Not like sperm banks we have now. So those days the procedures are little different, but you adhere to all the procedures, do the procedure, and like 40 to 50% pregnancy rate was there. So what I feel now is, what is deteriorating now is the egg quality, the sperm quality, the potential of the egg to form a blastocyst. that has down the line, deteriorated due to air pollution, due to water pollution, due to, like stress levels in our life. So, like we can discuss so many factors, which are influencing the gametes now. So, finally, the whole thing, see, now we have eliminated everything in IVF, isn't it? We don't need the tube, we don't need, the
Yeah.
yeah, like natural process
Cycle,
of
yeah.
childbearing, and like everything is done in a lab. So when we have eliminated all the other factors which were coming in our way, still we are not able to,
To get that much
in some patients not
success.
able to give them their own child
Yeah, yeah.
or their own baby.
Hmm.
Then somewhere in between comes all these factors.
Yeah, yeah. That
Yeah,
oligospermic.
oligospermia is less than 16
Yes,
million
yes.
according to WHO.
And azoospermic is not having
Any
the
sperms at all?
any
Yeah.
sperm at all
Yeah.
in this. And
Yes.
how many percentage of male population will have the azoospermia?
Actually, like just for the sake of everyone to know, 50-50%, God has been very considerate and, equal. Ladies are responsible or women are responsible in 50%, men are responsible in 50%. So that kind of, thing which was there in everybody's mind, that this is the work of a lady only. She is the one responsible for not bearing children. But now, actually, it has been, written all over the world. Everybody knows. Even in India, that concept has, very well appreciated now.
Appreciated,
Yes,
okay.
yes. Husband always comes
Yeah.
nowadays.
So is it correct to say, I was reading somewhere that around 1% of the human population, male, can have azoospermia because of totally no sperm or maybe of blockage in the reproductive organs?
Yeah. No, the percentage you're asking me depends on, what population you're screening.
Okay.
Supposing now you come to our center and, like infertility center, which is a level 3 center or level 2 center, then what would happen is, all those which were little minor factors got treated in the gynae clinics or, level
Okay.
1
Yeah.
clinics, and those
Yeah.
who are
Yeah.
coming there, among the male factor infertility, azoospermia incidence will be higher, oligospermia incidence will be higher, because that is a selected group now.
Yeah, because in the fertility center,
Yeah.
most of the people have
Yeah.
tried many things,
Ha.
and after that they are coming. So a couple of male factor
Yeah.
has not been gone through.
Yes.
So in that regard, as we were talking about, the women egg reserve. So as per you, what is the factor in the current day women should consider regarding their ovarian egg reserve or their fertility window? The women who are currently in 30s and 40s, as you know, we are getting married quite late in our life, and so the childbearing we are also doing later in our life.
Yeah, in India also the trend has caught on, like earlier all the girls were married after the age of 20-21, and any conditions, which would have affected their reproductive career later on wouldn't have been that effect on them, when they were younger. Like for example, PCOS, PCOD. So initially they are, PCODs are also fertile. Initially, their egg quality is better, they ovulate better. Down the line, when they progress towards 30, 35, 40, of course, they become, infertile. So, because the disease has progressed more. Same way about the decreased ovarian reserve also. Decreased ovarian reserve, which we are seeing at about 30, 35 now. After the age of 35, there is a sudden cliff, the sudden fall, which earlier our elders also used to say, produce a baby before you are
So
20.
after
Yeah.
35, you are
After
saying that.
35, actually, there is a very sudden drop, As you know, when a girl is born and she is in her mother's womb, she has about 6 million eggs.
Okay.
Yeah, 6 million eggs are there, which have been, like in her
Produce,
ovary
yeah.
when she was 5 months in her mother's
In the
gestation.
fetus, as a
Yes.
fetus. So
Yeah, in the
from 6
fetus.
million,
Yeah.
how
Yeah.
many
They
they
are,
will be
like
releasing?
at the time of puberty now, slowly they undergo, or like they are
Reduction.
apoptosis, that is
Yeah.
where, the cell dies. So then what happened is we have few lakhs, 4 or 5 lakhs. So out of them, if you calculate, supposing from 15th year or 12th year, she menstruated up to 40 or something
Yeah.
like that, So she has 400 cycles.
Mm-hmm.
She would have had 400.
Yes.
400 into 12 is,
That
that
many,
that many eggs only
Yeah.
became mature, and
Yeah.
they were capable of fertilization.
Around 5,000
Yeah,
eggs.
yeah, correct. So, like what happened to the rest of the eggs?
They may not be maturing, or what does happen to
You know
that?
what? Actually, nature is also very smart. What it does is actually it doesn't release all the eggs at the same time. So only one cohort is released, which is about 20-30 eggs. So other thing, it keeps it like a bank inside. Doesn't want it to come to that level where it will be acted by the brain hormones. So if you are not ready in the market,
Yeah.
then that produce is not coming out.
Body is giving a good supply and demand maintenance.
Yeah. So like that, even in spite of doing all those measures and being, very smart, still every cycle, same thing I tell my patients, don't waste your cycles, because one egg matures and maybe, becomes a baby, which is not becoming in you. You are
Yeah.
infertile,
Yes.
unfortunately. But along with that, you are losing 200 eggs every cycle.
Yes.
200 eggs are falling off in, your abdomen.
Yeah.
So use them, use them, freeze them, or like that.
So you consider that women in the present time, they should try to, if they want to have a family, uh, child in their family, they should try to conceive as early as possible.
Yes, yes. Actually, if
Because
you
every
are,
cycle they are losing much more better eggs, and towards the end of the cycle the body might itself is not allowing it to give out too many eggs.
yeah, yeah. At the fag end of your reproductive career, naturally, you have what you
Yeah.
have.
Yes.
And
True.
some cell which remains in your body, you are a cell biologist.
Yeah.
So who knows better than you,
True. True.
that
True.
any cell which remains in your body for 40 years, 44 years,
Mhm.
42 years, what is the state of affair of its DNA, its mitochondrial function, its other functions, which Golgi apparatus, everything you were telling me about. So all those, definitely will be deranged, isn't it?
Yeah. True. True.
Yeah, so what happens is like when you are younger, the best age, like I would say, but I won't marry my granddaughter or my daughter at that
True.
age.
True.
But
What
I
is the
would,
best age?
yeah, I would say 20, 22 years you get married, have a
This
baby,
is
but
going to create a controversy.
it will create a
Recently, some celebrity mentioned that people are not getting married early. They should get married early, and there was a
yeah,
lot
I
of
know.
hue and cry in the social media. There are many countries where they have, like in China, they have the 20th is the age by which the women should get married, and by 30 they should get have a baby.
That's all.
Roughly the same thing you are mentioning, which the age old practices in the other countries are being mentioned.
I think they are also traditional in some way like us
Yes,
only.
yes, yes,
So yeah.
definitely. They
So
are
they
very
are also,
traditional.
I think maybe in Indian rural areas also, like this is happening, and the semi-urban areas, where they get married early and have one baby. So, their reproductive, they're not at least that much worried like our city girls. So city is, in urban areas, what's happening is they are getting educated. They are wanting to find a very good partner for themselves. Girls have also become aware of that. Then they want to become financially independent also.
Yeah,
They don't want to be dependent on
yeah,
anybody.
yeah.
So by the time they do all that, it is becoming 30, 35 years. And then immediately after marriage also, they say we don't want to have a burden of a child, we want to enjoy for
Yeah.
some years. So like that, they are coming nearing 40. The very good option which is there for everyone is called as a social egg freezing,
Okay.
which so many celebrities did. I can even mention the names because they openly wrote about it, and they said, like
So the women, like in US, the many companies like Google, Facebook, Apple, Microsoft, they offer whichever women employee
yeah.
working in their company, they are offering insurance for them that they can go ahead and do the egg freezing, because they may like to have the fertility later on in their
Yes.
life. At the moment, they may not be ready, or they may not have a partner to go for a baby. So that is, do you think that that kind of trend is going to rise in India as well?
Yeah, yeah, that trend has already risen, Dr. Ali. Yeah, it has risen because this egg freezing. Sometimes I used to give like this, on the YouTube videos, or talk about this in the lectures, and to tell the patients and the relatives also. Nobody used to take it as something like which is very important for them. They used to say, "No, doctor, nahi, or that may be a far-fetched thing for us. My family will not agree." But now you won't believe what requests used to come. Like 5 or 6 in a year. I'm talking about 8, 10 years back, before all the celebrities did it, and like they openly talked about it. Now every month you get some page girls, coming to you saying that please do my egg freeze.
So I have a very out of the box idea to say that. Do you think that now parent, instead of giving the
Hmm.
asset to their girl child when they get married, they should also give them funds for doing egg freezing before the marriage?
Funds is not that much, doctor. Funds is not that much. Actually, I think if a girl who works in software and all, it is her hardly 1 month salary.
Okay.
Really.
So it is
Huh.
not much
No, not
cost
much
egg
of a,
freezing.
hassle also.
They can opt for going for egg
No, they can
freezing if
opt
they are
for,
not ready.
like,
Yeah.
and that kind of stigma they had earlier, no?
Mm-hmm.
Oh, she has frozen her eggs, like
Yeah,
that.
yeah. That
It is
is
not there also. It's
okay.
not
So it
there.
is
So,
reducing at
yeah,
the
it is
moment.
reducing, and so many communities and, across the, all the social strata also, I'm seeing that most of they are aware of it and they are coming.
As you know, the air quality index is quite lower in India. How does the air quality index affect the sperm quality and sperm DNA? Anything happen to them or it's okay?
No, definitely it is of a major significance and importance, Earlier, maybe some people used to talk about it, but nobody used to give any cognizance to that. They used to say, I say they were just like that. They are telling, huh? How can, the air particles, which are coarse particles or, fine particles, everybody knows about it. Nowadays, everyone looks in their phone and says, in Delhi, how
Yeah.
much is the air quality index today? But, in cities where this air quality is poor, pollution is more, groundwater is contaminated, and the food we eat, it is full of pesticides. It is full of, and the plastics we use, microplastics, you won't believe they have been found in the ovary also.
Yeah, we have
Huh.
seen in the sperm also.
Yeah, in the sperm, you have seen in the
We have
sperm
seen in the
also.
sperm also.
I'm talking about the ovaries,
Yeah, okay.
So, like all these are all called as endocrine disruptors.
Disruptor,
Yeah.
yes.
So, at the cellular level, you are aware of what
Yeah.
havoc it causes.
Mm.
Once you inhale those smaller particles into your lungs,
Mhm.
then actually they go into your bloodstream also. So, sometimes and all, I used to wonder why, in my student days, this PCOD used to be so, the incidence was so low. If a girl comes, with a typical PCOD, all the professors and everybody used to call us
Call us that
and say,
we got a
look at this
patient.
girl, huh?
Yeah.
She's obese, she's got hirsutism, she's got hair on her face, she's got acne. So everyone used to come and see. Although the girl used to feel very
Embarrassed.
this thing. So they used to say, see, this is the Steen-Leventhal syndrome, it was called in those days, PCOD. So maybe in a month we used to see one or two girls. But now the incidence of PCOD in our clinic, specialized clinics like this, the infertility it causes is about 30% of PCODs are responsible for infertility.
30%.
30% of the,
30%.
yeah, maybe 100 girls are there and coming to you for infertility ladies. Out of them, 30 would have, this PCOS problem.
So, do you have any recommendation that how to avoid PCOD for younger women or the one who are in a teenage time at the moment?
Yeah. Actually, there are, certain what you call signals or whatever, like some kind of a things will come in the appearance of the girl or in her history, which would actually forecast her reproductive career in the years to come. So, if any girl is there who has reached menarche late, I'll start from that age only.
So they should, whenever they see irregular period and
Cycles,
other thing, that
yeah.
time they should
Yeah,
go
yeah, they
and
should go.
go to
And the
the
mother should bring them,
gynecologist.
if they do
Okay.
not achieve menarche by 15 years of age. And WHO and certain, organizations have kept it as 16. Because sometimes unnecessarily they're alarmed and they will be roaming, from doctor to doctor. So they said wait at least for 15, 16 years. And before that also, if you are very particular, do certain tests and, be assured that nothing is wrong with her. Nowadays, ultrasound is so much available.
Yeah.
So if you see the uterus is normal, you can do an abdominal ultrasound for the girl and say she's okay. Any girl who has put on excessive weight and her body mass index is, reaching 30 at a very young age. And I told you about her physical features also. Your hair on the face, like obesity and having some dark areas on the neck of the this thing, hair loss is there. And she becomes very dull and everybody says she's not getting her periods regularly. So first complaint, the mother brings her,
To the
if this is
gynecologist.
good
Yeah.
and she realizes this may later on lead to infertility and things like that. So then we start doing the treatment in an unmarried girl also.
So it should be
Yeah,
treatable, right? If it
it is
treatable.
treatable. No, it is
Yeah.
treatable like lifestyle
Yeah.
changes.
So 30% of the cases can be reduced to much
Yeah,
lower if it is
much
treated
lower.
early.
Yeah. So then I was wondering why this PCOD incidence is so much rising. Then they said all these modern lifestyles, all these plastics, all these pollutants, they go and cause some type of, epigenetic changes in the
There is
egg.
a long-term changes.
Long term change. So the environment, how it affects your genetics also is there, no? See how we got modified from the time we were centuries back, and now we became like this.
So we were talking about the sperm quality decreasing or other things. So presently, there are some technologies are coming up which is about high throughput sperm selection, such as Spermotile. So do you see it will have any kind of positive or negative impact on IVF or ICSI process or outcome in the future?
Definitely. Like if you select the best sperm, see, like if there's in a room 10 people are sitting, so what would you like to select? You would like to select somebody, who's the tallest one, who runs the fastest. I'm not saying, like prejudiced way, but I'm saying if you want to have the best of the progeny, what would you like to have? You'd like to have the best of the sperm, which has a, like elongated head, the how many microns it should be like that. The central piece,
Should be intact.
yeah, should be intact, and the tail also has certain features which should be like that. So, and that should have an acrosome on the top of the sperm, and that acrosome is very, very important, and the shape of the sperm is very important, and progressive motility is also very important, where it goes the fastest in the whole field. You see, this will fellow will be running very fast. So if that kind of sperm our embryologist picks up, depending on the morphological features, depending on the motility of the sperm, depending on the, whatever he knows from his experience, that this is the best sperm and I should catch this one and put it inside. Because now out of maybe, we got 12 eggs for the patient or 10 eggs for the patient. So how many sperms we need? We need that many sperms
That
only.
many sperms
That
for
many sperms
ICSI.
only we
Yeah.
need. We don't need extra sperms. So he would select. But this is again a subjective selection. See, like how what I think, maybe this is the fastest one. You may not think like that. Like if you make two embryologists sit, no, they did this experiment also. They made two embryologists sit, same sample they gave, and they said, you say which is the best sperm, you say which is the best sperm. So like they varied in 40
Opinion
fifty
varies.
percent
Yeah.
of the times.
Yeah.
They said this
True.
is the best one. He said that is the
Yeah.
best one.
Yeah. True.
So if we have some tool, which is a scientifically proven tool, like which can tell us, okay, this sperm is morphologically the best, because like doing the finer functions for them is not possible.
Yes. True. True.
Yeah. So what we assume that if it is like this, it will also have a good genetic material in it. So like that, if we assume like that, then if these AI tools can help us, I was trying to see what latest we can add to our labs also. So AI is going to help us in selecting the best sperm for ICSI, or like it sometimes we have this 400 times of magnification we do
Yeah.
in our lab,
Hmm.
where we have still not incorporated the late, maybe this technique comes in. So there is one more called as best morphologically selected sperm. So there we do the magnification to 6,000 times.
Oh my God. 6,000.
6,000 times you are magnifying, and sometimes this embryologist who are working in the normal labs, they may have to be trained also for that.
On that regard, the device we are developing, we have to do within 10x and 20x magnification, not 6,000 or 600.
Yeah, that's what I would, I will,
Because
yeah, I was
higher magnification, we cannot have that much viewpoint. We cannot have that many sperm to evaluate. So if we do a very small, then we can see a larger. So you can
I
see
know.
the AI is helping there, that even with the 10x magnification, we are trying to bring this thing to the market.
Yeah, it actually came into the market. This device came into
Yeah.
the market. It's very expensive also,
Mhm.
but not many centers are using because because of this drawback.
Yeah.
Because very big sperm,
Mhm.
sometimes that you subjectively also you cannot decide whether this
Yeah,
is the
true.
best one.
Mhm.
So like older techniques only are good,
Are
where
currently
we
used.
so now like when we talk about, like you are telling about the sperms which we select by certain AI tools and all that, definitely they are going to play a very important role.
That's great. So now, since you have been leading this Federation of Obstetric Gynecology Society of India as a vice president, and you have been doing this job for a couple of years, do you think that Foxy has made any impact to the policy making in India IVF scenario and other kind of practices in India? Because one of the person was asking me that, do we have the ratings of IVF clinic from the government? Like we have a CE mark, we have FDA mark, we have ISO mark. Do we have you do you think that kind of thing is there?
I mean, the Foxy had a very big role to play, most of the things which were concerned with the social, parts of the female's life, reproductive health. anemias. Every place, Foxy was doing very good work. Maternal mortality, reduction of maternal and fetal mortality and morbidity. Then incidence of pre-eclamptic toxemias, incidence of anemias. So whatever was affecting our country at that time, and in a very big way, the other thing was happening. 40 years back, I used to go for camps, where we are doing 100 sterilizations per day.
Oh my God.
So, like each doctor is, given 25, 25, 25. So, from morning to evening, of course, that's by laparoscopic method. Of course, we don't compromise the patient's health. We take all the precautions. And, maybe in 9 to 10 hours, you complete. In 2, 3 days, you complete the target of 25 cases, So, what happens is at that time, because the infertility rate was not so high,
High.
and the birth rate also was
Was
high,
high.
like everybody used to have around 6 children. So 1960s, you remember, like that, six
Yeah,
children
yeah.
like down the line, now it has come in 2022, it has become to 2.1. 2.1. So two children per family, or for per couple. So if it falls to the Japanese level, like 0.7, or US level like 1.5, or Canadian level like 1.5, then what happens is the population growth will not be there.
Yeah, that will impact the country.
That will impact our economy, that will impact, our this thing, and our whole existence only, maybe down the line 50 years, if Gen Z, what is it called now, supposing they are not having kids, so they said that they are dating less also.
True, true. They are much diverted
uh,
into. There are many diversions are there. So they are
yeah.
dating less. They are having quality time less
Yeah,
with each
they
other.
are spending, more time on their own selves. Like, I mean, that is their lifestyle. We are not, anybody to say anything, but that has reduced the fertility index of India also. So once a highly populated country where the government and Foxy were, like trying to organize these things for the whole general public. Of course, we had a role to play in the ART Act, Act when it was passed. Also, the opinions were taken from the, leaders in the field and
In the
all that,
Foxy, yeah.
and everybody contributed towards making it a good law. So what happened is, up to 2020, we did not have any ART law. We did not have any ART law, but everybody, who's supposed to be in the field, the seniors used to tell the juniors that follow this kind of rules, follow ethical practices, where whatever you're doing, take proper consents, tell the patient about, very openly and transparently about whatever procedures you're doing. So maybe all the 80-90% of the, centers would be doing that, but still there will be some people who are, not adhering to the norms. So what very good thing happened was, like a lot of work was done in this field by the ICMR and organizations like Foxy and everybody, that this rule came into place, this act came into place. So it was passed in the Lok Sabha, Rajya Sabha and all
2020,
that.
yeah.
It was also passed along with the surrogacy law also.
Yeah, yeah.
Yeah,
I heard
surrogacy
about,
law
yeah.
also. First ART bill was passed, then all the, like I can tell you the finer details also of that, or some other podcast, because it takes a very long time
Yeah,
to
yeah, I
say.
understand that.
So like the center should be like this, so many quality norms have been put in place. You have to adhere to that. You have to register your center. Every 5 years you have to go and renew your registration. You have to pay that particular fee. You have to have this kind of personnel to work for you. Embryologist should be like this, everything has been in place now. So that's why this ART bill, has helped us all. And everybody has to do the work uniformly. And there is a national registry also now.
Can people check on the national registry
Yeah, you
whether
can
this
check on
clinic,
the every month we are supposed to send.
so the clinic is registered in the national registry
National
or not?
registry is every month you're yeah, you have to
You have to
register your
send.
clinic, send your data also to them.
Okay,
Like,
so the
how many
data.
IVF cycles you did,
Okay.
how many of them were, like with the self eggs, self
Mm-hmm.
sperms, how many were donor cycles,
Okay.
how many were surrogacy cycles,
Mm-hmm.
and how many were other cycles like IUI and other thing, So
Mm-hmm.
every month, every center has to send data to them.
That is wonderful. So now moving to this, we are focusing, whenever a patient comes, a lot of time we are saying that a mother bring the girl to the fertility places or a gynecologist. and lot of focus is there on the female factor, but as you mentioning that 50% is male factor. Regarding the male factor evaluation, what kind of minimum test or basic test do you think the male should consider?
It's a very welcome fact that all the males are accompanying their wives nowadays, very rarely. And then sometimes when they come alone, you tell, where is your husband? No, he is actually is going to come the next visit. So, definitely they're coming. They're coming forward. They're taking interest also. And earlier, you tell them semen analysis, this is name, mine is okay. So, but now they are immediately submitting
Okay.
to the analysis. So, in them also, like the female partner, we evaluate them. We see their, BMI. We see if there is any obesity is there, any hypertension, diabetes, any other diseases are there which can affect the sperm count. And then a male doctor or andrologist or a urologist will examine the husband also. Will examine the husband. A physical exam is very important for the external genitalia, for the size of the testis, whether any
Yeah.
hydrocele is there,
Yeah.
and what is the consistency of the testis also. It should be of the normal consistency. If it is very soft, smaller than the what is the normal size, like that, then all those points are noted.
But do you think that after doing a basic semen analysis, the external examination, if the semen analysis say that the sperm quality is okay, the external examination is needed?
Yeah, external examination is, still, I feel, it is a
It's
very
needed.
important part. No doubt, we are going for the scan and all, but nothing like the clinician's hands.
Clinician
And
hand,
the
yeah.
clinician's hand is the best thing which sends a signal to our brain, saying that, okay, varicocele is there, you palpated varicocele. Varicocele, is the, collection of the blood inside the veins.
So regarding the varicocele, does it impact the male fertility, means semen quality?
Yes, it
How it is? How does
how
it
it
impact?
it impacts is, we know that there is a venous plexus around the testis, and then if supposing these walls of the veins get affected, so what happens is lot of congestion takes place. This especially happens in certain professions, like where they stand for a very long time.
Yeah.
Bus conductors, this one who, I mean, by
Okay. So
profession
the
they are,
occupational
yeah,
hazards.
it's an occupational hazard also.
Hmm.
They're standing for a very long time. They're not sitting position or they're not lying down. So what happens is, because of the gravity, this will happen.
Yeah, this will
And
happen.
as you know that the sperms are very sensitive to the temperature change. So that's why we so many things have come up that we wear loose clothing, keep the temperature around the testis normal. Don't put anything which is like a device in your lap and all that. All those things have come in. So temperature little bit increase also. So in varicocele we know that temperature rises locally by 3-4 degrees.
Okay.
Yeah, that's why
So
nature
3-4
has
degree can affect.
3-4 degree can also affect. So that's why nature has kept the testis outside the body. See, any undescended testis is there. There will be some patients whose testis is an abdominal organ before, and then during after in the intrauterine period only it descends at some period of time. So if it has not descended and still in the inguinal canal, or sometimes inside the abdomen also, very much for type
Those are
of
the some rare cases
yeah,
are
rare
there.
cases, 1 or 2% of the males like that, or so one has descended, one has not descended. So then what happens is they will be having oligospermia, and both have not descended, they'll be having azoospermia only. And this testis, because it is not in the correct environment, is also more predisposed to undergoing cancer, change, and
Oh
malignancy.
my God.
Yeah.
So the external examination will help
Yeah.
in
So
knowing all those
immediately,
cases.
like after the baby is born,
Mhm.
child is born, the pediatrician will test that the both the testes, he will write also in his examination that both the testes have descended and they are in the scrotal sac. So if it has not descended, we have to inform the parents. Sometimes what happens, it will be mobile testis. Sometimes it goes up in the canal and sometimes it comes down into the scrotal sac. So like that there will be different
Different
categories. I'm
cases
just
are
telling
there.
you about that. So all those the parents also should know about it. And this surgery for the child, male child, has to be done very early, because if he reaches up to puberty and that time he realizes that I'm not having normal organs, and they take him to a doctor at that time, already the damage has been done.
I really am curious to know, you have many treated few thousand patient in your life. There are certain kind of pattern have you seen which is common, like which women are ignoring. They should have taken care early so that the fertility could have been achieved earlier.
Actually, that the thing that a stitch in time saves, huh? 9 like that. It's true for anything, and any medical condition deteriorates with age. So if supposing they had any symptoms like irregular menstrual cycles, or they had very painful cycles, that I wanted to emphasize and tell, and that pain persists even after the menstruation is gone. So some may have the pain on that day, but if the pain precedes that menstrual cycle, menstruation of the blood, and then if it actually stays back also, that indicates something like a predisposition to a condition called as endometriosis.
Okay, so the thinning of the wall.
No, endometriosis is, like when what happens is the menstruation takes place outside.
Mm-hmm.
In every girl,
Mm-hmm.
80% of the blood
Yes,
comes
yes.
out because there will be one channel,
Yes,
cervix
yes.
and vagina, it comes out. Even before the marriage also it comes out. But, like 15-20% of the blood through the fallopian tubes.
Okay, so it is coming
It,
from the
it goes into
fallopian
the
tube.
abdomen also.
Okay.
But our immunity and our phagocytosis tendency of the human, it will absorb all that blood. So next cycle it clears off, next a little bit comes. But these girls are not able to immunologically tackle that blood. So it goes on collecting in their abdomen. It forms large cysts. In the chocolate cyst it is called as. The local name for that is. Chocolate cyst means, the blood
Brown
undergoes
color, yeah.
alteration. For years together it is staying in the ovary. It decreases your ovarian reserve. It actually makes the menstruation very painful. Yeah, in the married life also they'll have problems. Lot of pain will be there. So this kind of girls, also should come and have a scan. So one I told you PCOD, if they could have prevented in the younger age. The other one is endometriosis. The third one in India, very common, this thing is tuberculosis and other infections.
Infection in the
Young girls.
Yeah, yeah,
In young girls.
gynecological parts.
Yeah. Now the incidence has very much come down, but earlier, when
It
we
used to
were,
be more.
yes, this incidence of tuberculosis and infections was high also. So that tuberculosis infection also spoils your tubes, spoils your endometrium also. So that kind of a symptom, if any girl's mother notices or she notices, and her developmental pattern is not correct. See, like when they reach menarche and they are reaching puberty, there are certain changes which occur in the girl. So if those particular changes were supposed to appear at that age, if they have not appeared, that also indicates, a chromosomal abnormality in the girl. So if it is like that, supposing you are having a syndrome of XO, that is, like Turner syndrome, it is called as. So these girls will be short statured, and they will be, they will not reach menarche in time. Even if they reach, they will be having very scanty flow, and they totally become amenorrheic. Amenorrheic means
Means without menstruation.
without menstruation. So like that kind of girls will have some eggs in them, but if they're not married by 2021, these eggs also will
Go
disappear.
away.
Because they are not having a proper genetic configuration, chromosomal configuration.
Yeah.
So if any such symptoms are there in the girls, and supposing they are living in an environment where there is pollution, where their diet is not good, where like so many exogenous factors are coming in. So if they prevented those things, like their reproductive health and their fertility potential would have been much higher. Of course, taking oral contraceptive pills doesn't spoil your potential. So that I wanted to just clear that
Okay.
misconception.
So regarding this misconception, we were talking about that people, what misconceptions are there in oral contraceptive?
Oral contraceptives, they used to think, like if we take oral contraceptives, maybe, our eggs get spoiled and all that.
Okay.
So they used to think like that. But the quality
doesn't
gets spoiled.
happen
It
that.
doesn't happen. It doesn't happen
Okay.
with the. On the other hand, because ovulation is not occurring,
Mm-hmm.
you are storing those eggs.
Mm-hmm.
So in a way, it may be little bit beneficial. Only.
Okay, so it is a better.
Yeah, this is a
to
better choice.
Better choice.
Yeah.
So now we had a wonderful discussion about many topic with our renowned doctors, Dr. Kiran. And so, Dr. Kiran, one thing I wanted to ask towards our end of the podcast, that going forward, lot of technological advancement happening and people are becoming more aware. And uh, what do you see the future landscape of IVF treatment and IVF in India?
The scope is very, very high, like I won't say because we are IVF specialists and we are saying like that. It's not because of that.
Mm-hmm.
But as I told you, the fertility rate of even a country like India is going down. No?
Okay.
And in the urban area, if I tell you the statistics, will be astonished actually.
What is the status?
What is astonishing is, like earlier when we started the clinic, 1 in 10 patients.
Okay.
He's IVF, needs an IVF,
IVF.
infertility. Now, like they're infertile. Slowly, this incidence has risen to 46% in the urban area.
46%.
One in three.
One in three
One
is
in three, or
needs,
sometimes one in two also.
means
Yeah.
half of the people in
Half
urban
of the
area. So
people
what
who are
age group do you talk about?
this one little later age group,
Okay,
little
35
yeah,
and plus.
35, 38, 40,
Oh,
like that,
40s.
So
Okay.
out of three couples, one couple is finding it very difficult to conceive on their own.
Mhm.
So imagine the quantum of infertility incidence which is rising.
High.
Definitely that it is one of the things we have to treat, no.
Mhm.
See, like that's what you were asking me, the national policies and all, where we can influence the policy makers, is I would say that insurance should be provided to these couples.
Yeah,
Uh,
that is a factor. One more thing I have come to know that
Yeah.
we have the national insurance scheme by
Yeah.
healthcare insurance by the government to people.
True.
In that, the semen analysis is not included.
Not included.
Which is a very basic test, and 50% men can test and can get the treatment early. So
And at least they'll be aware of it, and they can
yeah,
follow certain prescriptions, and nowadays everybody is very aware, no, health
yeah,
conscious.
yeah,
So
true,
they would
true.
have themselves done also
Yeah,
something,
yeah,
So insurance is not there.
yeah.
Insurance is not there for IVF, and like for infertility treatment for male infertility. So that should be incorporated.
So, Dr. Kiran, we were talking about embryo and you look into the embryo. I have heard some term called PGT, which is a pre-implantation genetic testing. What is the role of this kind of testing, and how does it? Is it help? Is it not help? Is it needed to be done, and when it is needed to be done?
Yeah, this is a very relevant question in today's scenario, Dr. Dilip, because what happens is, genetics has come into every part of our life, isn't it? Like we talk about inherited disorders, and this genetic affects the sperm quality also, affects the egg quality also, because there are certain inversions, sometimes translocations in the chromosome, sometimes other factors are also there where there are deletions in the, especially in the male partner. I think that if we correlate and see, the sperms which are not running fast, they'll be having micro deletions on the long arm of the Y chromosome, because Y chromosome is the one which defines the male.
Defines the male.
Yeah.
Yeah.
So and it's only one. It's not having any counterpart in the female. So if there anything happens to the Y chromosome, no,
There is no balance the other
there
side.
is no balance on the other side.
Hmm.
So what will happen is it will going to have a very serious impact on the reproductive health of the male partner. So, like in the male factor, you are asking me about azoospermia, which is 2 to 3% of the population, and infertility, it is 7-8% population. So these people will have certain micro deletions on the long arm, which are called as azoospermia factor, AZF, AZF-A, AZF-B, and AZF-C. So, like if you like divide the long arm like that. So AZF-A and B are really very
Common.
cases which are not at all having a good prognosis. Whatever you do for them, you take out the TISA also, like you take the sperms from the testis.
Testis also,
Yeah,
tese.
they will not be having sperms. These two people will not be having sperms. Whereas an obstructive azoospermia will be having sperms,
Okay.
because the production in the factory is okay.
Is there,
The
but
sperm-
there is obstruction.
but
in
there is an
the-
obstruction, and so you go proximal to the obstruction,
Mhm.
put your needle and take it out.
Take it out.
Yeah.
Hmm.
Or else you can take a testicular biopsy,
Mhm.
or you can do a microsurgical technique also.
Mhm.
Put it under the microscope, take the tubules, and from there you take the sperms.
So, because we are talking about so many rare cases and there are treatments are available, so I have a last question to ask you. Do you think that almost every infertility cases can have the medical solution to become a parent?
I won't say every medical case, but like as we are touching upon all these micro deletions, and they are little bit difficult cases to have with their own. And pre-implantation genetic of the diagnosis of the embryo also tells us this embryo can be put inside or not. In a
Okay,
short, I want to tell you that. Yeah.
So you recommend that PGT need to be done.
PGT, not everybody, not the young patients, not the ones having genetic difficulty, patient having repeated pregnancy loss.
Okay, so you recommend, like I have one friend. Actually, I came to this fertility device development only after knowing the case, and I came to know that this is a bigger problem. So the patient has 18 failure, means 6 or 7 times has got pregnant
Yeah.
but couldn't keep the pregnancy. But finally, after 18 cycles, they got it. So at what number of cycle failure do you
We
recommend?
usually say repeated pregnancy loss of more than 3.
More than
More than
3.
3 indicates
Okay.
a PGT.
PGT.
If supposing some baby earlier has some abnormality, that abnormality we can detect in this embryo and not put that embryo.
Okay.
That is a preventive aspect, like they'll be very much benefited by that. That is called as a PGTM.
PGTM.
Monogenic disorders.
Monogenic
disorders
Okay.
also. And then PGTS is for screening of all the
Screening
embryos.
of all the embryos.
Yeah. And PGTA is for aneuploidy of the embryos.
Aneuploidy of
If
the
any embryo is aneuploid, doesn't have the chromosomal number
Chromosome
only.
numbers,
So
yeah.
it may be having
No need to
45.
transfer that.
Yeah. So, we don't transfer
Yeah.
that.
So
That is
those
a-
all things can be tested. Does it the PGT testing, does it allowed from the government point of view?
Yes. We have to tell the, fill up a form. You have to properly take the consent of both the parents. And then the doctor also, we have to also write down what is the indication.
What is the indication?
What is the indication?
What
Why
we
you
are
are doing
testing,
it,
yeah,
like
why?
so. Because it should not be misused.
Because you're talking
Yeah.
about misuse, right? When you are doing genetic testing and Y chromosome, X chromosome.
That
So
we are not supposed to.
in that time, the genetic disgrading can be the male and female grading, gender grading can also be done.
No. That's not allowed by government
not
and by
allowed.
the company also will not tell. It will only tell us the report of the 22 autosomes.
Okay, not
It
the
will
23rd.
not mention. It will not mention
Okay.
the other pair, the one.
Okay, but if they see a Y chromosome defect like AZA, B, C,
That is, only when we do the chromosomal analysis of the testing of the male partner only. Not
Okay.
after making the baby.
not after making
No,
the
not
baby.
after making
Okay,
the baby.
okay.
Micro deletions are done on the spot.
On the
in the blood
father,
only.
on
In
the
blood,
father,
in the blood test.
on the father only.
On the father only. On
Okay,
the father
okay.
only. Yeah.
That's wonderful, Dr. Kiran. Wonderful to have you, and I hope our viewers are going to learn a lot more from this podcast. And we have a very senior doctor. Almost we can call her as a one of the four mother of IVF treatment in India. Thank you, Dr. Kiran.
Thank you so much. It was nice discussing all the latest advances, and then hope we meet again and then talk about
Sure.
other,
We will talk about more on the new advancement and new
new advances,
new
which
knowledge and new sharing. Thank you.
Okay,
Thank you,
so-
Dr. Kiran.